Childhood obesity is one of the more pressing health concerns in Harris County. In fact, more than 1 in 3 kids 12 or older are considered overweight or obese. Joining us now is Dr. Vernica Porter-Sales, Chief of Population Health with Legacy Community Health. Hey, good morning.
Good morning. How are you?
So tell us, paint the picture of how bad this problem is for us. How much has childhood obesity gone up, say, in the past decade?
In the past 3 decades, childhood obesity has more than tripled in our adolescents and doubled in our children. More specifically, 12% of the 2 to 5-year-olds and 20% of our 6 to 11-year-olds, 22% of our 12 to 19-year-olds are labeled as obese. Here in Texas, 20% of our children are obese that are aged 10 to 17 years of age.
It really is such a startling number every time I hear it, and then to hear such young ages also being classified as that, it's very sad. But really, truly, tell us about the potential consequences of not addressing this. What are their long-term health complications from being considered overweight or obese as a child?
Obesity puts a child at risk for a variety of health issues, including diabetes, high blood pressure, heart disease, joint disorders, to just name a few. In addition, there's some negative psychological outcomes such as depression, poor body image, low self-esteem, eating disorders, and even behavioral and learning problems in school.
Yeah, and I mean, it might not just lead to one of those things. It could lead to a whole combination of those things, too.
Absolutely.
You know, and the problem isn't just that kids need healthier habits. I mean, of course they do, but sometimes realistically, parents work 2 jobs. Kids live in a household where they're with a single parent. There is not time to cook or take kids to play. So sometimes the solution isn't that simple. Do you have any real life solutions that could help us improve this health crisis?
Absolutely. First of all, it needs to be a family approach, and something as simple as replacing sugary drinks and juice with water is an easy start that I incorporated in my own family. In addition to that, you can have your child, step away from sugary cereals and stop eating so many pastries. Those are just a few. Fresh fruits and vegetables we know are hard to come by, but it's possible. In addition to that, you can have your child move more. We know our kids are sedentary. You need to, they can walk pets, they can engage in school activities. Those are just a couple of things that they can do to try to decrease this trend that we're on. And finally, reducing screen time. This is going to be a challenge. Our children are on more screens than ever before. Their classwork is even on a screen. So doing your best to just try to engage your child to get outside, even though it's hot, move more, and drink more water are some of the few things that you can do to try to help the child.
Dr. Porter-Sales, I'm going to ask you one more question. When you've seen a child successfully go into a healthier weight range, has it been when the whole family has made those changes?
Absolutely, and I think it should be a family approach to begin with. It's a trend in families to cook and eat from a cultural perspective.
Yes.
But when we do it together, I think the success is longer lasting.
Yeah, and just have the fresh produce and the healthier options at home, because like I mentioned, a lot of times kids are left to feed themselves at home. There's not always an adult there to guide them. So that's probably a good first step.
Absolutely.
All right, Dr. Vernica Porter-Sales with Legacy Community Health, thank you so much for joining us this morning. That was a really good insight.